Strong mentorship is critical for achieving success during and after your vascular surgery training. This video has been developed for young surgeons to help them become a more effective mentee. The video also explores the factors that can impact the success or failure of a mentorship, as well as how to best find mentors. Importantly, it also focuses on ways to successfully make the shift from mentee to mentor while managing the transition from training to practice. Mentorship in vascular surgery can span the clinical, educational, research, professional, leadership, and personal realms. To better utilize mentorship in your career, you must first understand the roles of mentors and mentees.
Well, one of the questions is, what are the qualities of a good mentor? First of all, it's important to be able to listen. Everyone comes with their own concerns and their own goals, and I think it's very important that the mentor understands what those goals are. Now, that's not to say that you just accept, their goals, because sometimes those goals may be misdirected, and I think it's important, having listened, to try and redirect those goals towards goals that are fit both for the mentor and also for the divisions that the mentee is actually going to be participating in. So that's important. But broadly speaking, you want to make sure that a young academic surgeon is successful in all aspects of the triumvirate that we consider a part of academia: clinical care, research, and education. And people have different strengths, so we can weigh these differently. So I think it's important to identify, what are they interested in? And that comes from listening. And because it's impossible as a mentor to try and move somebody to do something that they don't particularly want to do. So we want to understand, what motivates them, and then to set up structured goals by which they can actually achieve those. And I really see the job of the mentor as being able to mutually get to those goals, and that's to encourage them to participate in both the regional and the national organizations and to achieve the goals that are predefined.
Certainly the mentee should look for a role model, a person who can be aspirational on multiple levels. The most obvious of these is acquiring the technical prowess in the operating room and the cath lab. While becoming a proficient operator is certainly important, there are other attributes that are probably even more important. How do you choose the most appropriate therapy for the individual patient? This is probably the very most important. There's an old saying that you earn your living doing cases, but you make your reputation by not intervening. So look for a mentor that demonstrates wisdom in case selection and patient management. I can't underscore the importance of professionalism in demonstrating compassion, empathy for patients and their families. It's equally essential to show respect for nurses, OR techs, colleagues, residents, and consulting services. While most vascular surgeons certainly have a healthy ego, arrogance and condescending behavior are poison pills, and you should avoid potential mentors that demonstrate these kinds of attributes. Finally, I believe a good mentor also humanizes him or herself to their mentees. Work-life balance is important, particularly so today, and a good mentor will model this and show the importance of family and activities outside of medicine.
Ultimately, when you come into a residency program or fellowship, generally a mentor is assigned to you. Remember that should not be really the best way of identifying the person who's going to guide you along your pathway. You would like to pick a mentor that essentially can offer you the most appropriate guidance, and that usually means somebody that has a compatible personality with you and some foresight and understanding you as an individual. Therefore, it's not always that a mentor is ideally found in your facility. You may have to look outside of your facility, and I would say don't be afraid of doing that. There are ample opportunities. We're a fairly small community, and people are generally very willing to help even outside of your facility. A mentor will guide you through whether it's academia you're leaning towards or just a clinical practice, they can offer you guidance in a multitude of different ways. It may be somebody that when you get out into practice you can call on to run some cases through. It may be somebody who advises you on your NIH grant, but it has to be somebody that you're compatible with. That is the most important goal.
The mentor himself should provide the experience of what's happened to them, both the goods and the bads, and it's important to have a share of both. It's important to offer hope of what can be, and also to offer warnings about what shouldn't be or what should be avoided. Ultimately, it comes down to the mentor offering a more experienced viewpoint and an outside viewpoint of your career and life as they are now, where you're hoping to be in the future, and how to help you get there. A mentor can be invaluable, but it doesn't happen by accident. It should be meaningful, it should be purposeful, and deliberate.
So as a mentee, you really want someone who is smart, goal-oriented, receptive to suggestions. But at the end of the day, this relationship is a two-way street. The mentee and the mentor need to jointly establish these goals. They need to meet regularly. And I think that the mentee will be rewarded by being more successful. And as a mentor, you get great reinforcement by the reflected glow and basking in the reflected glow of the achievements of your mentee.
Early on, it'll be very helpful to you to realize that even though you may get great experience in your fellowship, there's a huge learning curve when you first get out. And you should not be afraid to seek support and advice on cases from other faculty in your department and also previous faculty that you have worked with in the past. I think it's important as a woman. I think sometimes we reach out to our professional colleagues, but it is very nice to also reach out to your female colleagues. I have a network of women both in general surgery and vascular surgery who I occasionally speak with about complicated cases or different work scenarios, and sometimes our perspectives are pretty similar about a lot of issues, and so that's pretty validating at times and very helpful and has been helpful to me over the years. And I personally try to make it an effort to reach out to female faculty members and try to support them when I can, because I realize sometimes our road is slightly different than my male colleagues.
One of the important things that mentors and mentees sometimes have to deal with is personality conflicts. And by that I mean that sometimes the mentor has a certain idea of how the mentee should behave or what kind of career to embark on. And I have had several of these over the years where I thought somebody would be much better off going into, say, an academic program or maybe better suited for private practice, and yet the mentee didn't realize this. And I think that that's an important problem to try to resolve. The role of the mentor is really to advise the mentee, but I don't think that beyond that, pushing them more than they would want to accept is probably not a reasonable thing to expect. I think we all look up to the people who trained us. I certainly look up to my mentors, people like Dr. Rutherford and Dr. Sumner and Dr. Harkin, who are all great surgeons, world-renowned, and they set a great example for me to follow, and hopefully I can help the people coming through to be great surgeons as well.
It is critical to understand that there are pros and cons of a mentor-mentee relationship. It's important to understand to set the right expectations from both sides. A mentee on one hand would like his mentor to be available at all time, every time, and the other way around as well, for a mentor to be sure that his mentee is available. Doesn't really happen all the time. I might expect my mentee to be ready with all his plans for the next 5 years, and he might be caught up doing something else or really having a personal commitment. I think it's critical to understand that a mentor-mentee relationship is any cordial relationship at any workplace. It is important to understand each other's expectations, each other's limitations, and have a healthy respect for each other's time. and that would probably be a blend of the good and the bad.
I had the privilege of working with medical students, residents, and fellows for the past 10 years. If you look at some of the surveys done, what really got medical students interested in vascular surgery were mainly identifying with a mentor, either through research or just going and seeing them on rounds and in surgery and liking vascular surgery. So I think that's really important to keep that in mind and try to reach out to the medical students and take them under your wings and get them interested in vascular surgery. Meanwhile, the residents and obviously fellows are already in vascular surgery, but if you talk to the residents, what really got them interested in vascular surgery is usually the cases and the complexity of the cases and the variety of cases between end and open what got them interested in vascular surgery. But also we know what's important for the medical students are the special interest groups, where we have different groups. And typically what we did, for example, in Houston, is that we got some of the residents and fellows to be in charge of the special interest group, to reach out to the medical students and kind of mentor them, and then that will help them to transition from being a mentee to a mentor.
One of the reasons why I went into academic surgery was to be able to train vascular surgery residents and fellows. I think it's important as a mentor to maintain a balance between clinical supervision and independence in order for them to be a successful vascular surgeon when they graduate. Some other important factors in becoming a good mentor would be to help them conduct their research in something that they're interested in and have passion for, as well as co-write chapters in order to get them on the vascular map. Introducing them to other vascular surgeons at national meetings or in their own hometown would help them increase their mentoring team. And when they're close to graduation, going over their CV, as well as meeting with them to talk about the pros and cons of the job offers that they have obtained, is essential in their vascular surgery career.
I encourage all of you to find a mentor no matter where you are in your surgical career. Mentors help you reach your full potential. They cheer you on when you succeed, and they guide you when you encounter obstacles. Mentors also can help you combat burnout by looking out for your professional and personal well-being, connecting you to professional and social networks, and guiding you to your career passions that will help you feel fulfilled. While a surgical career can be complex and intense, you can find balance between your professional and personal lives and between career and family. One of my biggest champions is my son Taylor. When he was little, he thought all surgeons were female. He later wrote his college application statement about me and how I wear different hats in my role as a mom, a wife, and a surgeon. When he asked how I do it, I told him I only wear one hat at a time, and whichever one I'm wearing, I'm entirely dedicated and focused on that task at hand. As you progress through your surgical career, you too will wear many hats. And I encourage you to also put on one at a time to ensure more balance in your life, to avoid burnout, and to help you achieve the greatest success.